So in your opinion, what will be the future expectations for treatment of hormone-positive HER2 metaplastic breast cancer patients?
I think the field has made some major progress. Definitely looking now at the patients with ER-positive breast cancer metastatic setting, we have a lot more to offer than we used to just 10 years ago. To see overall survival benefit in Mona Lisa 2 trial for the first time breached that 5-year mark, the overall survival being almost 64 months. To me, that's a sort of a watershed moment. 5 years of life is a lot more than maybe 2 or 3 that these patients had not so long ago. However, we're not curing these patients yet. I think we need to understand a lot more how we're going to combine agents into these higher order combinations, more than just 2 drugs, monotherapy plus CDK4/6 inhibitor. Well, that's a first step in the whole process. We need to try to understand how maybe 3-4 drug combinations can be developed, and how they can sort of hit the tumor in a synergistic fashion, produce even deeper responses that last even longer. We need to understand how to combine targeted therapies with either chemotherapy or antibody drug conjugates, or perhaps immunotherapy. The work in this area is just starting, but my hope is that